All right, thank you. And so again, the May 13th video is on our website if you wanted to watch that. And tonight's webinar is really going to focus specifically on Medicaid expansion. Of course, we'll look at Medicaid expansion in North Carolina, or the lack thereof, and what that looks like and what we hope to see for it. And then we'll also take a broader view of Medicaid expansion across the country, what that looks like, and how it impacts people with bleeding disorders, so that then we have a well-rounded view of why it's so important for Hemophilia of North Carolina members to be pushing for expansion in North Carolina. I want to remind you that our legislative day is coming up. It will be virtual, of course. They will not let us in the legislature this year, nor do we really want to be there. So that's going to be June 16th. Please register if you haven't already. If you'd like to set up meetings with your representative and or senator, our Vice President, Phil Poovey, is setting those up for us. And so he'll work around your schedule so that you could do those either by phone or through like a video conference like Zoom or something like that. So if you're interested in doing that, please register ASAP so that we can get those meetings set. Even if you don't want to have a phone or web meeting with your senator, legislator, representative, you can still do other things throughout the day. We have some volunteers on here that are working on social media posts and things like that, as well as a letter that you can send on the day of, emails that you can send on the day of. So there's a lot of opportunities there, but please register so that we can make sure to send you that information for June 16th, as well as June 15th, we're going to have an optional, just very informal webinar talking about what to expect for that day, answering any last minute questions, and then also just sharing some dinner together like we would if we were doing the in-person training like we do most years. But with that, I want to thank you all again for coming. This is a really important topic. And I'd like to introduce Rebecca, who's from the North Carolina Justice Center and has agreed to come on tonight and volunteer her time to talk about a very important subject. So thank you, Rebecca.
Of course. Thank you so much for inviting me. I'm going to share my screen because I have a PowerPoint. So let me do that. Okay, slideshow from the beginning. Okay, can everyone see that okay?
Yes.
And everyone hear me okay?
Yes.
Wonderful, thank you. So why we need Medicaid expansion more than ever. So like Charlene said, my name is Rebecca Cerese. I'm the Health Engagement Coordinator at the North Carolina Justice Center. I work in a small team on healthcare policy advocacy. I am the person that collects stories of people who have fallen into the Medicaid coverage gap. So I'll be infusing some stories into the sort of facts and figures that I'll be presenting tonight. And it really is a really critical time for Medicaid expansion, of course, because we're in the middle of a public health crisis. Okay. So a profile of North Carolina's uninsured. Over 500,000 North Carolinians are employed, yet uninsured. North Carolina has the 8th lowest rate of employer-sponsored health insurance coverage in the nation. Now, with COVID, after about 557 North Carolinians filed for COVID, and of course this number has actually gone up, the new number for people that are that would be sort of eligible for expansion is now up to 750,000. So 750,000 of our friends, family, neighbors in North Carolina would be able to get health insurance through the Medicaid system if we expanded Medicaid. And sadly, industries with the greatest number of uninsured workers are the workers that are on the front lines, the workers that have been called essential workers. Food service, childcare, retail, healthcare assistance, construction, education services. In fact, I just recently spoke with a woman, Siobhan. She works at McDonald's and she has diabetes and high blood pressure. And she does not have insurance through her employer because the insurance that they have offered her is too expensive, and it has a really high deductible. And because we'll talk a little bit more about this, but because she does not have dependent children, she does not qualify for Medicaid. So when people are uninsured, there are consequences for all. So even if hopefully most folks that, you know, are the hemophiliac folks, the folks blood disorders, hopefully have coverage, there's other things going on that have consequences for all of us. So people skip routine screenings, doctor's appointments, filling prescriptions. Sadly, people wait until advanced stages of the disease to get care, risking permanent disability. A woman that I knew, that one of our storytellers, Deanna, she had an abnormal pap smear, but she had been pregnant, and so she had Medicaid while she was pregnant. Unfortunately, she lost her baby, so going through all this grief, and with it, she lost her Medicaid. So she was not able to go to the doctor for another 1.5 years. When she finally did go to the doctor, she had stage 4 cervical cancer. And instead of just having a very simple procedure at the front end, she ended up having to go through 8 months of very intensive chemotherapy. So not only was it so much more expensive, but it also obviously deeply impacted her quality of life negatively. People accumulate huge medical debt and or experience bankruptcy. Just want to point out, we're the only country in the developed world that allows people to go bankrupt because they've gotten sick. People miss work and may lose their job if a condition goes untreated for too long. Some people who are against Medicaid expansion will say it gives you an incentive not to work. It's actually the opposite. It gives you an incentive to work. It keeps you healthy enough to keep going to work. There's also uncompensated care in the ER. So when people don't have insurance, they wait so long, they end up going to the emergency room, the most expensive type of insurance, healthcare there is, and they can't pay their bill, which leaves huge uncompensated bills for North Carolina hospitals. And this is why so many of our rural hospitals across the state are actually struggling financially, even before COVID, because they have these huge uncompensated care costs. So the cost of uninsurance for North Carolinians, you can have early death, lost productivity, financial instability, drastically worse health, like I was just saying, broken families, because that's another big piece of Medicaid. Medicaid covers substance use disorder and mental health disorders. So we have all of these folks, that 256,000 uninsured North Carolinians have mental illness or substance use disorder. And what that ends up doing is they end up oftentimes getting criminal justice involved. So incarcerated, instead of dealing with things as a health issue, it ends up turning into a criminal justice issue, which is not good for anyone. And like I said, more expensive treatments. So real quick context for Medicaid expansion. Medicaid expansion was part of the Affordable Care Act, which of course offered protections for people with pre-existing health conditions that we didn't have before, financial assistance on the marketplace, or healthcare.gov for people earning 100% federal poverty to 400. That's what we know as the subsidies. Allows children up to age 26 to stay on their parents' health insurance plan, and expands eligibility of Medicaid up to 138% of federal poverty. And I'll just go a little bit more into that in a second. So to qualify for Medicaid right now, what we call traditional Medicaid, you must have a low income and fall into one of the following categories. You have to be pregnant, people who are blind, elderly, living with a Social Security certified disability. So you have to have Social Security disability in order to qualify for Medicaid, living with a dependent. So that means people that do not have children are completely 100% ineligible for Medicaid in North Carolina right now. So that would be me. I don't have children. And for a while I was unemployed, and that's when I found out that no matter how poor I was, I would never qualify for Medicaid. So I would never be able to get health insurance that way. So this is just a good graph to show what we're talking about when we say the Medicaid coverage gap. So Medicaid now covers 0% federal poverty to 40% federal poverty, but only in those categories we just talked about. The marketplace gives subsidies to people 100% federal poverty to 400. So that leaves a very big chunk in the middle here. Anyone who is low income that does not have dependent children into this, what we call the Medicaid coverage gap. And sadly, like we said, there's a lot of people right now in North Carolina in the Medicaid coverage gap. So if the North Carolina General Assembly expanded Medicaid, an estimated 500,000 North Carolinians can gain coverage. And like we saw on that first slide, it's actually more now because of the unemployment due to COVID-19. More lives would be saved, of course, increased access to preventative screenings, more people accessing care and treatment for substance use disorders, much better health outcomes, and thriving communities. And this has been proven out. So 36 states and Washington, D.C. have expanded Medicaid across the country, and every single one of these has been proven in research. There's better health outcomes. Of course, the insurance, people who are uninsured go down, better care, better outcomes in terms of cancer, better maternity, maternal and infant mortality, like mortality rates go down. So just overall, it's just a positive step forward. So benefits of expanding Medicaid. So the federal government, so Medicaid is jointly administered by the federal government and the state government. And the state the federal government covers about 64%, and the state covers the rest. With expansion, though, as it was imagined in the ACA, it actually, for the first 3 years, covered 100% of the costs. So huge uptick from what we had. Now it will never go below 90%. So again, it's much higher than the traditional match rate of the federal government. It will cover 90% of the expansion. And we have also found out in North Carolina that healthcare entities have said that they would cover the other 10%. So that means no taxes raised to cover the people that right now are ineligible for Medicaid, but would become eligible if we expanded. Of course, higher productivity from a healthier workforce, because COVID aside, sadly, we know so many jobs in our economy do not offer health benefits. They might not even be full-time jobs. And so you do have a lot of people that are working that are not covered. More jobs, if you have billions of dollars coming in to cover folks, the rural hospitals will be in better shape. You could potentially even open more clinics, which can bring more people in. Also, places that have hospitals attract businesses. Places that don't have hospitals or, good health care, why would people go and start a business there? Costs are reduced for everyone by covering the uninsured. So we talked a little bit before about the uncompensated care. That jacks up the prices for all of us because the hospitals have to make that up somehow. And so that ends up increasing the prices for the insured people. So overall, costs would go down for all of us. And like I just said, reduce uncompensated care for hospitals, especially important in rural communities, and reduce medical debt, meaning better credit and being on a pathway to financial security and stability. So many people that I've spoken to are just in medical debt up to their eyeballs, $20,000, $50,000. And of course, then it wrecks their credit. Then they can't get housing. They can't get a loan for a car. It's just a cycle that we're putting people in for no good reason. The North Carolina Voters Back expansion, 2019 Meredith poll, yes, 68%. 2020 poll, I can't see because I'm being blocked, but as you can see, it's the majority. So this is a popular program. People want it expanded, and yet we still don't do it. So Medicaid expansion and COVID-19, want to sort of put it in the context of today. A public health crisis is further complicated by lack of Medicaid expansion. These are the numbers from today. I'm sure everyone has looked at these. We just have horrible numbers in North Carolina. And, what happens, like we said, if you don't have health insurance, even if you have symptoms, you're not going to go to the doctor. You're not going to go to the ER because you're worried about costs. And so that, in the middle of a public health crisis, is really terrible for all involved, because then that person is not being treated, does not know whether they're sick or what kind of sickness they have, and then they can be spreading it. So Sydney Batch, Representative Sydney Batch has actually introduced a bill, House Bill 1040, which would actually close the Medicaid coverage gap. She just did that at the end of April, and the Senate Democrats just, I think last week, introduced a companion bill for this. So the North Carolina Democratic Caucus is trying to address this issue by pushing forward Medicaid expansion bills in the legislature, but they are being completely ignored and buried. So just a few things. Expanding Medicaid is an urgent need. It is one of the best tools our state can use right now for people during the COVID-19 crisis. It will help workers hit hard by coronavirus. If you lose your job, a lot of people can potentially lose their employer-based insurance. Maybe then they don't have money coming in. They can't afford a plan on the marketplace during special enrollment. This would be an amazing safety net for them to have during this really difficult time. It also compounds inequities that leave many communities of color more susceptible to infection and death. So not everyone is affected by the coronavirus in the same way. And sadly, like in the rest of our healthcare system, people of color, in particular African Americans and Hispanics, are really disproportionately impacted by a lot of health issues because for so many reasons, and one of the biggest ones being racism, systemic racism, and that leads to lack of access to care, issues with housing, nutrition, all sorts of things that are social determinants of health. And of course, if you have underlying health conditions, COVID is even more lethal. So these are the disparity numbers in North Carolina. These are from a few weeks ago, but so African Americans are 22% of the population in North Carolina, but they're 37% of the cases. So again, you can see it's disproportionate. It's also rural North Carolina is being hit really hard. You hear a lot about like Mecklenburg County, Wake County, but a lot of the rural areas, if you look at per 100,000, the infection rate per 100,000, so rural is being hit harder than the urban and suburban areas, 257 cases per 100,000 to 204. And then you can see here, Duplin and Wayne County, again, infection rate per 100,000 are dwarfing Wake and Mecklenburg here. So this is something that's less spoken about. And of course, like we talked about, rural hospitals have been closing or they're struggling. So folks in rural North Carolina do not have good access to hospitals close by. Some people have to travel 45 minutes, an hour, or even more to get to a hospital. Health providers on the front line of the coronavirus support Medicaid expansion. So many physicians, nurses, providers are totally in support of expanding Medicaid because they see every single day in their practices, in the hospitals, what happens when people don't have insurance, how they get sicker and sicker. And most of them got into medicine to help people, to cure people, to heal people, and they can't do their job. If they give if they prescribe medicines, people can't afford it. Or if there's follow-up that they need to do, people can't afford it if they're uninsured. And that really, really hurts doctors. And in fact, it leads to a lot of burnout for physicians. And I have spoken to Dr. Stephen Luking, who's a family physician in Rockingham County. Every single time I've spoken to him, he's broken into tears thinking about his patients and the fact that he can't help them the way he wants to help them. Expanding Medicaid can help working families now as the economy worsens, like what we were just talking about. Medicaid has a history of helping people in times of crisis. Expansion can make us more resilient. If we have health coverage during this time, it can help us be healthier, have access to preventative care. Expansion can help slow the spread of COVID-19 because that way, if people feel symptoms coming on, or even if even just slightly, they can feel more comfortable to go to a physician and not worry about crippling medical debt. And expansion helps the most vulnerable. Like we talked about, who's eligible for Medicaid. It's the people that need it the most. Oftentimes they're on the front lines, the public facing jobs that put themselves at risk to be essential workers. I was also asked to just quickly talk a little bit about some legislation that's happening right now. So wanted to just quickly talk about Medicaid transformation, which is a complete overhaul of our state's largest public health insurance program. It was supposed to happen at the beginning of this year, but because of the budget standoff, and we were left without a budget, it did not happen, and it was put on indefinite hold. So basically that is changing Medicaid from a fee-for-service that is administered by the state. It ends up going to managed care companies, and it's sort of like people get like a lump sum to take care of these patients. So it is a massive transformation, a massive overhaul of the system administratively. So now North Carolina Senate leaders, this just happened like last week, are pushing SB 808, which calls for a shift to managed care now, in the midst of a pandemic, right now. So SB 808, like I just said, it calls for a rapid transformation of Medicaid, which would jeopardize the lives and well-being of over 2 million children and families with low incomes during the COVID-19 pandemic. So the reason why we are standing against this right now, it's pretty obvious, but just wanted to point it out. North Carolina's healthcare systems need to focus on COVID-19 response, which is still devastating families across the state. We do not need to pull DHHS out of the COVID focus to overhaul the entire public Medicaid system right now. It's absolute insanity. Also, this is a time for Medicaid expansion, not unnecessary disruption to the Medicaid program. Medicaid expansion is what's needed. We need to expand coverage for people during a pandemic, not disrupt it for the most vulnerable amongst us. Transforming Medicaid the right way actually costs a lot of money, and that's not really part of the legislator's current budget. So again, where's the money going to come from for this particular endeavor at this moment, when it really needs to be going for other things? So this is, with COVID-19, it's the wrong time for SB 808. North Carolina should expand Medicaid, not disrupt it. This was just seen in appropriations today. We're going to find out more about what's going on, but we are taking a pretty big stand against it right now because it's just not the right time for it. That is my info. Hope I didn't go too quickly, but if you have additional questions or know anyone that wants to share their story, there's my contact, and I'm happy to take questions, or we can wait till the end. I wasn't sure how we were going to do that, Charlene.
Well, there's one in the chat, so we'll go ahead and do that. And I have some, but mine can wait until the end, and then that way whoever wants to answer it can. But Karen asked, for the purposes of our outreach to legislators next week, would you recommend we reference supporting HB 1040 or the Senate bill you mentioned? If so, do you have the Senate bill's name? And would it be best if we reference the benefits of Medicaid expansion in the COVID crisis and the SB 808 issue, in addition to how Medicaid expansion would impact the bleeding disorders community?
Okay. Yes, I would say HB 1040 is what we've been pushing. Representative Batch actually had a petition up. The Senate Dems, actually I was looking for the bill and I couldn't find the number, but I'll get back to you on it. They, so Representative Batch with her co-sponsors, they actually had a press conference around announcing this bill, and the Senate Dems have not done that yet. So I'm not sure why, because to me, it just completely makes sense to expand healthcare during a pandemic, and especially because it's hitting poor folks so hard, and also people are just losing their jobs and needing this insurance, and it's a health crisis. So yes, I would rally around HB 1040. I will look for the Senate number and I will get it to you all. Yes, I think the Medicaid expansion benefits for the COVID crisis is the perfect way to address it right now. With the high unemployment numbers, looking at it as a safety net, the fact that it will not cost the state anything to expand coverage right now. 90% is covered by the federal government, 10% will be covered by the providers. And okay, and the last one was SB 808 issue in addition to how Medicaid expansion would impact. Yeah, I mean, that's a really good question. I'm not sure how many folks in your communities are on Medicaid already, but I think folks with, I don't know if they fall into complex medical needs. There's certain populations who are on Medicaid. So Medicaid is hugely complicated. It has many different little buckets. It's not just one program, right? So there's folks that have complex medical needs that are not going to be forced to go to this managed care. But again, this makes it even more confusing, because even when they tried to roll it out at the end of last year, notices went out to the wrong people. People weren't sure who had to register for it and who didn't. So it's just not the right time in any way to be doing a major overhaul like this. I hope I answered your question.
Thank you. Yes, it looks like you did. All right, and thank you again, Rebecca. If you'll hang out again at the end, I think we'll do just a full question and answer. And with that, Nathan, would you like to go up next? So this is Nathan Schaefer with the National Hemophilia Foundation. And if you were on the webinar last month, you heard from Nathan that he's got some information specific to Medicaid expansion. Perfect. Thank you, Nathan.
Can you see my screen?
Yes.
Okay, great. Well, hi everybody. It's good to be with all of you. I just have a few quick slides about Medicaid expansion as it pertains to the bleeding disorders community. But first, I have to say, Rebecca, that was a really, really great presentation. You really summarized why it's so important. And you've got the North Carolina specific information that I'm not able to provide. So I think that was great. This is the map and from the NHF policy team. I work with all of the states that are colored here in blue. I live in New York City, for those of you who don't know. I haven't left Brooklyn since the 10th of March, so I'm getting very antsy. So it's always good to be able to connect with folks like this. One of the things I noticed about this map as it relates to this map is that of all of the states I work with, the 3 that have not expanded Medicaid at this point are North Carolina, South Carolina, and Florida. This is the map of the country. All the blue states are the states that have expanded Medicaid at this point. It's 37 in total. The 3 that you see shaded, Nebraska, Utah, and Idaho, those were all done most recently through a ballot initiative, which is also true in Maine. Actually, in Maine, they had 2 ballot initiatives to expand Medicaid, and the legislature passed things, and the governor at the time still wouldn't do it. So I wish we had sort of a cookie cutter approach for all of these states, but they're all done very, very differently. If there's one that has the greatest prospect of expanding through legislation from my vantage point at this point, it is North Carolina. I do also anticipate that Missouri they're going to have a ballot initiative. It's going to be on the ballot in November in Missouri. Don't really have a crystal ball to tell you how likely it is at that point. But to Rebecca's point, I do think that the COVID pandemic has brought about newfound opportunities and rationale for why we have to have consistent, reliable, and affordable healthcare. And I'll speak more about that in a little bit. Rebecca, you were saying you weren't sure how many people in our community are covered by Medicaid. We now think it's around 30%. Before the Affordable Care Act gave states that opportunity, it was under 25%. And I can't tell you exactly how many people with bleeding disorders live in the United States. We estimate it's about 20,000 people that have hemophilia. But if you look at von Willebrand's disease, which is much more pervasive, it's anywhere between 1% to 2% of the population, but it's very, very, very common that it's not diagnosed or even misdiagnosed. So we don't have a concrete number, but we can say it's about 30% of the bleeding disorders community at this point, which is great. So you mentioned who could be eligible, and that expansion can cover adults without children. I can tell you, I'm not going to tell you which states, but there's a young man who's 25 years old, who has hemophilia, and he is about to finish his master's degree, but he is in a state where Medicaid hasn't been expanded. And given the prospects of him finding a good job, he's worried about getting a job that has comprehensive health insurance. And we can talk about just how important insurance is for people with bleeding disorders. He's actually planning to move back to his home state where Medicaid has been expanded so that he can have reliable coverage, which is a terrible predicament to be in, but I think could be used as a good talking point and good rationale. And you could even make an argument that North Carolinians might be coming back to get access to quality care in the event that you're able to expand Medicaid more broadly. I'm not going to get into some of these other trends because I don't want to unnecessarily provide any kind of anxiety, because you're not seeing some of these things happen in North Carolina at this point. But I can tell you that there are at least 16 states now that have implemented preferred drug list for bleeding disorder treatments. That means that you can only get access to a certain list of preferred drugs. And those decisions are often made by Medicaid officials, and sometimes they don't have a familiarity with bleeding disorders, which is our job as advocates to make sure that they do. In the event any of these things do pop up in North Carolina, we will work with you every step of the way, because we've seen how this has happened in other states. The other thing I'll say, and let me just go back to this, you can obviously see that there's regional differences, right? It's really in the Southeast that hasn't expanded Medicaid. But I do feel if you're able to be successful in North Carolina, it can have a ripple effect. And hopefully in time, some of other nearby states would be able to do so as well. Again, I'm not going to get into the prior authorization and the preferred drug list and all of those trends that we've seen in other states. Suffice it to say, the Medicaid space for bleeding disorders patients is complicated because we're rare. We don't have a huge number compared to many other disease states. And the complexity of the care requires a understanding and appreciation of what it's like to live with bleeding disorders. So we often find ourselves educating not only legislators, but policymakers as well. I brought this up on the last webinar in May, and I just wanted to reiterate it. One of the things I think that you as advocates can do in order to prepare yourself to be as successful as possible is make sure you've got advocates from every corner of the state, because oftentimes legislators will only listen to their constituents. Sometimes they'll only take meetings with their constituents. I don't know what is the most relevant committee for the bills that we are prioritizing, but I would encourage you all to figure out if you've got someone from the chairperson's district and the ranking member, which would be the highest ranking Democrat in those committees, as your number one target for making it a priority, that you've got someone who has a good relationship. And then these are just the distinctions for the House as well. I have two final thoughts that aren't included in my slide. And well, I guess this one is just about absentee voting. Again, we're nonprofits. We never tell people how to vote, but we remind people about their right and their responsibility to vote. And you can vote absentee in North Carolina, and here's the link to make sure you can do that. My final two thoughts. The first is something that happened on the May webinar, and I have to respectfully disagree with the senator, and I was really pleased that he was on. He was very, very engaging. But he was asked the question, what do we do about engaging folks that don't agree, or engaging folks across the aisle? And he said, don't bother. I significantly and respectfully disagree with that. Advocates have to work with everybody. We're not bipartisan, we're nonpartisan. So we have to work even with the most conservative, even the people that you think are unlikely to work with you. You never know. You never know until you have the conversation. So I say talk to everybody under the sun. And when you do find an ally that is a unlikely supporter, ask them who else you think we should talk to. Who else might we be able to convince, or what other kinds of arguments can we be making? You have to be creative and comprehensive. The final thing, Rebecca, you talked about the woman that ended up, she didn't have coverage and then she got stage 4 cervical cancer. And that is terrible. And it immediately made me think about bleeding disorder patients. Because imagine what it's like if you've got a joint bleed or a brain bleed and you don't know about it and you're not getting access to care. Or you end up developing an inhibitor. I don't have to tell all the folks on this call, that's going to be infinitely more expensive if you don't have prophylaxis treatment and you're not getting regular care and you end up having to go to an emergency room to treat a very difficult joint bleed or what have you. I just think that argument resonates with bleeding disorders folks, and I think we can make very good arguments about how we're going to save money if we're able to ensure that people have reliable access to healthcare. I'm going to stop there, and I'm happy to take questions. I know Kimberly's going to have a few thoughts to add as well. But thanks for having me.
Thank you, Nathan. And I posted the absentee ballot information in the chat box for everybody. So we'll definitely make sure to have that available. There's really no excuse not to vote, unless you have a genuine excuse, but most of us don't. And with that, I will turn it over to Kimberly from Hemophilia Federation of America. And then again, anyone that has questions, you can put them in the chat or ask them once we're done.
So hi, my name is Kimberly Ramseur. I am from HFA. I think oftentimes when I get on these calls, I forget to say that I actually am in North Carolina. I'm outside of Charlotte and Gastonia, so I am not far from many of you guys as well. So I'm also in the fight with you personally as we talk about issues like this. So one of the things I did want to start out with is talking about our history in the bleeding disorders community when it comes to health insurance access and prior to the ACA and having the ability to have discussions about Medicaid expansion. And so for specifically in our community, we oftentimes didn't have access to comprehensive coverage for a variety of reasons. If it was because of bad insurance policies with pre-existing conditions that prevented us from having access to coverage, limited Medicaid eligibility, high cost of out-of-pocket expenses, as well as lifetime caps. And so with the passing of the ACA, we were able to get a lot of these things taken care of. And so we've come a very, very long way. But unfortunately, what we have also seen is that we still do have coverage gaps, as Rebecca did mention. And so this is the opportunity where Medicaid expansion would come in to help provide some type of coverage to help close the gap for individuals who may not have been able to get health insurance coverage through other means after the passing of the ACA. And so this oftentimes brings up, you know, what is the difference between having coverage when you live with a bleeding disorder? It varies, you know, across individuals and families. For a lot of people, sometimes it's just, you know, just not having basic coverage. But for us in the bleeding disorders community, it often can be the difference between life and death. And even if it's not life or death, it could be the difference between having serious bodily injuries or, you know, anything else in between that. And so it is a really critical thing for us to advocate for coverage and access to comprehensive coverage that will provide the care that we need going forward. And so at HFA, we represent, you know, pretty much every state or have member chapter orgs in every state across the US. And so some of them do, states have Medicaid expansion and some of them don't. And so we've been fortunate enough to have conversations with families and individuals who have been fortunate to reap the benefits of having expanded Medicaid access. And I can recall a few months ago talking to an individual who lives out in California who talked about, you know, growing up and being able to have access to his HTC and treatments because his family did receive services through Medicaid out there, and then he himself being able to benefit from the services growing up. And he spoke very highly of the program. And I know it varies depending on who you are, but he really said that, you know, he never had any issues until he was no longer eligible to be on it and had to get separate insurance when he ended up getting a new job. But, you know, that's California, and we're on the East Coast. Other states that have expanded, as we saw the map earlier. Just early last year, Virginia did enact their newly expanded Medicaid program. And so we're learning more and more about how different individuals with bleeding disorders across the US and states with expanded Medicaid access, how that really plays out for them. And, you know, like I said, it varies, but a lot of people have had very positive feedback because, like I said, it's the difference between life and death most oftentimes. And so it's very beneficial that our community have this access, you know, at all costs. And so I know we talked about quite a few other things, but I wanted to start a conversation about if we are to get Medicaid expansion, some of the things that we don't want to see that goes along with it that we're seeing play out in other states. And there has been some talk that it may be part of legislation going forward if, you know, they were to pass Medicaid expansion in North Carolina. And so one of the things we've started to see in other states are conversations about block grants. And if you're familiar with block grants, where states are actually submitting requests to the federal government to be able to block grant the funds that come from the federal government to pay for Medicaid within their states. And so specifically within our community, you know, it could mean limited access to treatment. If you ask for a certain amount of dollars and then the state runs out, the state is left and it is on the hook for paying the rest of the amount going forward. And so for us, we know that we are having new treatments coming down the pipeline for new gene therapies. If you have a new product that comes out that year and you're asking Medicaid to cover that, that limits the resources that they can put towards, you know, your particular treatment and having you be able to access that treatment if a state decides to block grant that funds. And even now, as you see with COVID-19, if a state has block grant their Medicaid funds and they run out, the state is oftentimes left on the hook to cover the rest. And so for not only the bleeding disorders community, but just, you know, as a whole, it's not typically seen as a really good idea to have states block grant, submit requests for block granting their Medicaid funds. And so one of the other things we are seeing is work reporting requirements, where a lot of states are kind of putting that together with their Medicaid expansion proposals as well. For our community, it varies. They do have exceptions that come along with these new policies, but oftentimes some of our community members fall within the exception and then some don't. So that means that we could have a lot of our members or community members, family members, friends, individuals losing access to coverage if they were to get that Medicaid expansion and then immediately losing it and then trying to figure out how else do you get coverage in the meantime while you're trying to secure employment that fulfills the requirements of the work reporting requirements in that state. And so that's definitely not something, you know, we don't want to see being put in legislation here as well. And then Nathan also talked about preferred drug lists and how, you know, some states do have them with their Medicaid programs, but we want to make sure that if you are going to have them, that they understand the importance of not just singling out some products just because it's cheaper, because it may not work for everyone. You know, that decision is between you and your provider and no one else. So if they decide that they want to cover one product over another, and that particular product doesn't work for you, you know, again, that puts in another barrier or challenge to you getting access to the care that you need. So just, being mindful going forward, some things that we might start to see or have seen already be a part of the conversation that for our community, it's a non-starter. And, we definitely don't want to see that being put forth as an option going forward. So that's really all I had, but I'm open to having any questions, comments, or whatever. Here to take any.
Thank you. So does anyone have any questions? I know I do, but let's open it up first. Don't be shy. You can unmute yourself. You can send it in the main chat, or you can send it privately as well. And so while that's going on, I will ask, and Rebecca, this may be geared towards you, but also on a national level, Kimberly and Nathan may be able to answer this. I mean, what is the pushback? Why it seems so simple, and maybe it's because we're looking at it from the perspective of people with chronic conditions, but what is kind of the biggest pushbacks that we should be prepared for as advocates from folks across the aisle?
Well, first off, unfortunately, it really is ideological. It's not really based in any kind of rational fact. I've heard all their, pushback. So they say there's no guarantee that the ACA is going to remain the law and cover 90% of the match. That's one of the things, which of course can easily, the legislature is going to pass it, they can unpass it, or they can do a little amendment that says if something changes and the federal government stops matching at 90%, then we can revisit this. The other thing that they say, and this to me is the most egregious, is they try and pit people with complex medical needs that are doing the innovation waivers and some of these other waiver Medicaid programs that have really long wait lists, and they're trying to pit them against people under other Medicaid, right? So they're saying, well, look, there's these giant wait lists for people that have complex medical needs and kids. Why are we putting them in a contest against able-bodied working people who somehow apparently don't deserve to get health care? The truth of the matter is those waivers have nothing to do with expanding Medicaid. At any point, the legislature can actually vote to expand the number of waivers that they offer and not have wait lists that sometimes go on for 10 years or something, which is crazy. Those are basically the two main, the system is overwhelmed already. What is going to be adding, 500 to 600,000 going to do to it? The thing that they, again, are not being honest about is like a lot more money is going to be coming in from the federal government on this, so they can actually hire more people, so it wouldn't be stretched thin. You would be able to save rural hospitals, and so you wouldn't have the, those facilities closing and then people being forced to go to other facilities, which could potentially overwhelm them. So those honestly are like two of the main. They also say something weird about how most people that are in the gap actually qualify for subsidies. It's not true. Again, no real reason. It's really ideological.
Yeah, and I think if those people in the gap were eligible for subsidies, I think that there's a lot of smart people and organizations out there that are trying to help these folks. So if there was a way, these people wouldn't be uninsured right now.
Absolutely. And plus, some of those plans aren't that great. What good is it to be insured if you can't use it? I mean, this is another big problem, which is separate from Medicaid expansion, but we have huge numbers of people in this country who are underinsured, who have insurance, but basically can't use it because of huge out-of-pocket costs, huge deductibles, co-pays that they can't afford. So yeah, it's crazy.
Yeah. And so, Kimberly, you mentioned about block grants and how that would be bad for our community if that were in the Medicaid expansion legislation. And so I think I understand that it's because of the restrictions that they would be able to have within the block grants, and that we wouldn't be able to have the flexibility if these new products or treatments come to market. But would you mind just explaining just a little bit more in case somebody isn't familiar with block grants? I know that that's something I definitely, am not so educated on.
Yeah, so essentially, when you're funding your Medicaid program, the number that you get from the government can vary depending upon how many people are actually on your system, what you need to care for each patient each year when you're getting your dollars. What a block grant will actually do is you say you want X amount of dollars, and if it were to change, it really doesn't matter. So if the numbers go up, you're still set on having that number. And so the state is responsible for still covering even the extra individuals and added costs that those individuals may have off of those limited dollars. And so that could have been based upon, when you had a certain amount of people on there and they didn't have, especially for our community, we didn't have a new gene therapy product on the market that we needed access to. So, it places our community in a bind. It places the state in a bind. It places providers and the companies that have to deal with this issue. How do you make sure that you can get your product and services to patients when you don't have the appropriate amount of funds to treat them, and you can't, ask for more just because you ran out? You have to wait and then reassess. But by that time, so many people have been unable to access the treatment or products that they need. And so, like I said, for our community, we don't have the ability to wait to get additional funds. That can mean so many unfortunate things for us in our community.
Thank you. And then there was a follow-up question. Why would states want block grants?
Most often it's to control the cost. So if you can limit funds by asking for a low amount and make good use of those funds, and you can prove that, then they'll give you a lower amount. And really it's about saving dollars for the government at the end of the day. And
yeah,
patient families end up having to deal with the consequences of that instead.
And so oh, go ahead, Rebecca.
I just wanted to jump in there. It's a terrible deal for states, actually, because they end up being on the hook. But what it is it offers them certain flexibility to cut certain programs. And so really it is code for conservative legislatures to cut Medicaid. I mean, that's basically what it is. And that's why a state that has a conservative legislature that doesn't like social safety net programs would be interested in doing block grants.
And that's actually what I was going to follow up with, is that what we've seen is that it's really the Democratic states or Democratic-led states that are expanding Medicaid without these restrictions. And it's, I've heard about, even in North Carolina, we started hearing rumblings about possibly having work requirements within North Carolina's Medicaid expansion when they were really trying last year. And so that was one of the things when we talked to the governor's office, is saying that, they kind of said we might need to bend, but we will get this out. If we can just get Medicaid expansion passed, we will change this. But we're just trying to get it passed. So I know that they try to negotiate as much as they can, but of course we want to push a clean Medicaid expansion bill because that's what's best for the community.
If I could just jump in one more second about that aspect. It actually has been brought to court and has been challenged successfully. The courts have thrown it out, saying that work reporting requirements are not in line with the reason the program exists. And like I had mentioned, most people who are working, it's just another shame tactic and another way of just making, separating people, doing the worthy versus unworthy thing that unfortunately they do so often.
Yeah, which is really sad. And so one of the questions, and this might be rhetorical, but Rebecca, you were talking about the 10% being paid anyway. But even if we had to pay 10% out of our taxes, wouldn't that be less than what people than we're already paying because of people that don't have insurance and can't pay, so that uncompensated care?
Absolutely.
I imagine that that's got to be 10% or more.
Absolutely. And I mean, just the fact that providers, okay, like doctors, hospitals, are willing to pay it just shows you how much they're losing because we haven't expanded Medicaid, that they'd be willing to foot the bill for that. I mean, they're not ecstatic about it, but they've offered it. So yes, absolutely. And plus, I mean, this of course gets into, this is my little soapbox about taxes in general. Taxes are what we pay to have a civilized society. We hate taxes right now because we're getting a really bad return on our investment. It's not going to social safety programs and building up real opportunities for regular people. It's unfortunately all going to tax cuts and corporate subsidies and the military industrial complex. So it would be a great thing for us to say, even if we have to pay the 10%, so that all of us, and especially again in this public health crisis, we realize now that we're only as secure as we're only as healthy as the least insured amongst us. I mean, if people aren't able to get it, then that endangers all of us. So it's about looking at it in a more communal way.
Agreed. And then Nathan, I will ask this question to you, but if you want to punt it to somebody else, feel free. You talked about a couple of the states getting Medicaid expansion passed on the ballot. Do you think it's possible that North Carolina might see this on their ballot in November?
I don't know. I mean, it's entirely possible. I just don't know what the laws are in North Carolina to be able to do that. And I would venture to presume it's probably too late to get it on the ballot for this year. But Rebecca or Kimberly might know more than me.
North Carolina actually does not allow people to put anything on the ballot. The only people that can put anything on the ballot is the General Assembly, the legislators. So that's what, I mean, it would have been great. We wish we had that opportunity to create a ballot initiative because we think we would win it. It's won in deep red states like Nathan showed in his presentation, Idaho, Utah, Nebraska, like certainly not hotbeds of liberalism, but it makes sense for people, but we are not able to do that. So the only way it would be on the ballot is if the General Assembly put it there. And we know that's not going to happen.
And even Rebecca, from your presentation too, seeing the percentage of people that are for Medicaid expansion, and that's where my mind went, is if these are the people that are voting, it would be really nice. But that's good to know that we won't see it right now, so we know where the fight needs to be. And then my last question, unless anyone puts any questions in the meantime, would be, Nathan had mentioned about one of the ways to try and help push things through is to really look at what committees are important for, like the HB 1040 and the Senate bill, the companion bill. So again, the committees, the chair people, and not that, Rebecca, you need to know who those are, but how would somebody, and this is a general question for our advocates, how would somebody find those answers out?
You could just go to the NCGA website. It's actually a really good website. And they have all the committees on there. They actually finally put video in now too. You used to be able to just listen to all the committee hearings, just audio, but they actually finally have put a video component in there as well. I would say it would be, if it even gets a hearing, it would be in the health committees. And then it ends up going to appropriations and then rules. Those are the normal committees that these sorts of things go to before it's brought to the floor for a full Senate or House vote.
Great, thank you. And yes, I know they were updating their website. I don't know if it was a year or two ago, but it was painful during that time because all these broken links and things and just trying to get to anything. So I was glad to see their website is updated and in the 21st century. So with that, any other questions from folks or comments from our speakers before we end? All right. Well, thank you all again. If you have not registered, please register for Legislative Day. It's storming here. I don't know if y'all heard that.
I do, yeah.
Okay,
Don't forget the picture.
Oh, thank you, Jillian. And I thought too, because we had some people drop off, so we'll do a screenshot of some of the recording. But yes, I do need to take a photo. So if you want to turn your screen on, I'm going to take a photo, and I will give y'all the warning because I hate it when people take it and we don't know. All right, so I can't get my thing to go away. Okay, 1, 2, 3. Okay, perfect. Thank you guys. So we'll send you out an email after this that has the link for Legislative Day. So anybody that wants to register can register. And again, it's not just one day. We will continue advocating every day. So any day that you feel like doing it, but you're not sure what to do, please call us, email us, and we'll help you out because this is really important for the community, as we just heard from Rebecca, Kimberly, and Nathan. Again, thank you. Have a great night. And I hope the storms don't hit y'all too hard.
Thank you
Good
so
luck
much
next
for
week.
having us.
Thank you.